We're going to call it to order with minutes. Does somebody want to approve the minutes of January 27th?
So moved.
Okay. Do we have a second? Jay and Lester and Don, thank you. All in favor?
Aye.
Aye, thank you. Okay, moving forward, we're going to OFA, and I think I saw Gina here. Morning, Gina.
Good morning. Good morning.
How are you?
I'm doing fine, thank you. I have only a couple of items that I would like to share with the committee today. The first being a request for the Washington County Board of Supervisors to appoint Kathy Jo McIntyre to the Office for Aging Advisory Council. This position is to fill the vacant position left by Patty Hunt when she retired. The term that she would serve would follow suit to Patty's term and would expire at the end of the 2021 year.
Thank you, Gina. Do we have a motion to make this appointment? Okay, Brian?
Second.
Thank you, Daryl. Any discussion? Okay, all in favor?
Aye.
Aye.
Any opposed? Thank you, Gina. And we
Thank you very
welcome
much.
Pat. Yeah, we welcome KJ.
The next item is really just informational. As many of you know and are aware that February is a month where a lot of agencies and organizations do a lot of state and federal advocacy. For the Aging Network, I wanted to share with you just some information. At this time, area agencies on aging have reported that there are older adults waiting for 11,000 different types of services in the following categories: personal care level 1 and 2, home delivered meals, case management, transportation, personal emergency response systems, home mods, and more. Here in Washington County, I can share with you that we only maintain wait list for personal care services and case management. We had a wait list for home modifications and minor repairs. However, as you're aware, when LEAP severed our contract, we're no longer able to provide those services, so we no longer maintain a wait list for them. In addition, after reviewing more than 2,000 individual case files of those older adults who are awaiting services, but were not receiving them from the years 2017 to 2019, 10% went directly to a skilled nursing facility, and 6% went to community Medicaid/MLTCs. Due to the incomes of this population, along with their functional limitations, most, if not all, would spend down to Medicaid almost immediately, costing the state hundreds of millions of dollars. The continued investment in addressing unmet needs, therefore, has significant cost savings for the state Medicaid program, while assuring a policy that doesn't require individuals to impoverish themselves in order to get the care that they need. By investing in these supports, New York will not only be ensuring an improved quality of life to those in need, but will inevitably help balance the state's budget by reducing Medicaid expenditures. More specifically, findings indicate that in New York, savings from just 1% increase in meal service, which is our home delivered meals, would lead to $11,427,143 of Medicaid savings. The cost of the 10% of those on the wait list that could enter a skilled nursing facility without services would cost Medicaid $165 million. Again, those numbers are for the state of Michigan. So what I'd like to do is expand on this. And following today's committee meeting, I have developed, in cooperation with our Aging Association, a document that truly outlines the services that we provide and also is more descriptive in terms of how we can save the state and the county Medicaid dollars.
Excellent.
That's all. Thank you.
Yeah. When would we all have this?
I'd like to send it out in a PDF form via email If anybody would like a hard copy, I most certainly can have that as well sent up to a mailbox in the Board of Supervisors chambers.
I think Brian has a question.
Yes.
Sure.
I have, is, I understand this is a good idea. I like the idea. But as far as the state goes, I assume this is all for the state savings on Medicaid, not for the county, because with us having a cap, we like have a certain percentage which is above that cap. So all the savings, I assume this is in the governor's greater interest, is the savings will come off and we still will not get under what our cap number is. I hate to be negative on that part, but I just see this as a win for the governor, not a win for the county. But I still think we should always try to be as efficient as we can. So thank you.
Okay. The other spin, most certainly, and I could give you several different spins on this, is, as many of you know, the services that my department offers. The mission of the services are to keep individuals in their homes and in their communities for as long as possible. So in turn, those individuals still reside in Washington County and still pay county taxes and make purchases as well.
Thank you.
You're welcome.
Does anyone else have any questions for Gina on this? And I couldn't appreciate what you just said more, Gina, having many calls from different people needing vaccines, and they're home and they're happy to be home, and they want to stay there. So anything we can do to support that
Yes.
ability to do it safely and ethically, that is excellent. So thank you. Anybody
you.
else have questions for Gina? Okay.
Okay, thank you. And just following that, I welcome any questions. Brian, you did raise a point, and so if anybody would like to discuss that more individually with me, I welcome any conversation you may have. Thank you.
Thank you.
Okay. So going on from Gina to Ken. Is Ken Winchell here? I think I saw him at one time. Hi, Ken. Good morning.
Hi, morning, everybody. I'm here.
Yeah. You're up next.
Thank you. I just wanted to highlight the position posting for the PFC Dwyer peer-to-peer program between Warren and Washington County. This is a program we've had for well over a year now, and the position was originally vacated last year at about the exact same time as the shutdowns happened due to the pandemic. But I'm excited to announce that the position has been posted again. We're looking to hire any candidates by, I think the submissions are due by March 5th. Once the March 5th deadline hits, then we'll start the interview process for hiring. You can apply at my office in Washington County or at the Warren County Veteran Service Office. It's also posted on the civil service websites. I just wanted to put that out there to try to get the word out as much as possible. I know we have 7 candidates so far that have applied. Some carried over from the application period last year, but they're still interested. So we have 7 so far, and looking forward for some more. And that's all I have.
Thank you very much, Ken. Any questions for Ken? Okay. Okay. So we're moving forward.
Thanks, everyone.
Yeah, thank you very much. Okay, we're going forward into Mike Gray for Youth Bureau. Hi, Mike.
Good morning, everyone. I'm seeking permission to backfill vacancy for program specialist. The program specialist works directly with PINS youth, persons in need of supervisions, and youth involved with JDs. And also, it can accept and work with youth that are a part of the sheriff's pre-arrest diversion program. It's program specialist title. There are 4 others in our office that are working directly with other programs. Position is 62% state funded. The total cost of the position is $61,567. Our local share would be $23,400. However, working with DSS in preparation of the STSJP and Raise the Age plan, we're able to identify about $84,000, almost $85,000 and revenue, additional revenue that this position would help support. And also this position also would help the county receive an additional $64,000 in revenue. So the need is there for the position. The revenue supports the position. And I'm just asking to backfill that position. If in the event you do approve that, that's going to create a vacancy for a program assistant position, which I'd ask to backfill that one because it'd be promotional.
Okay. Do we have a motion to, for the JPR
Both
program?
the personnel, I think that whole thing should be discussed.
Okay. So do we want a motion to move it to personnel? Is that what you said,
Yeah,
Brian?
there you go.
Okay. And do we have a second on that?
Second.
Okay, John Ward and Jay and Darrell, thank you very much. All in favor to move this to personnel?
Aye.
Aye. Any opposed? Okay. Okay, Mike?
And I'd also like then, if that is being moved, also permission to backfill the program assistant position, which is in the current budget. My thoughts would be to promote within, so that would create the vacancy for a program assistant. So I'd need permission to backfill that as well.
Okay.
So,
Okay, Brian's moved. Do we have a second?
Second.
Darrell, second. Okay, all in favor?
Aye.
Aye. Any opposed? Okay. Move to personnel. Okay, Mike?
Thank you. The last thing I have is at the end of March, I'll be working with Granville Central School District to develop a program there for youth court, local youth court, where they would handle violations of school code of conduct. It would be self-contained, the school would run it, but I'll just be doing the training on that program. And I'm looking forward to that. So it'll all be done virtually, of course. So
Wonderful.
that's all I have right now.
Thank you very, very much. Have a good day.
Thank you.
Yeah. Okay, so we're going to go into public health. KJ, are you on? Oh, there you are. Good morning. KJ?
How's that, better?
Much better, thank you.
There you go. Good. Well, hold it, you may change your mind after this. I'm not so sure, but we'll go from there. Well, good morning. First of all, of course, you know, our hot spots right now are the vaccine clinics and stuff. We're starting our second, a round of our second doses. So far, we have vaccinated 1,872. So we're starting our second, our round of second doses, and we're continuing to get more doses every day, every week and stuff, continuing with the first doses. That's, you know, that's quite an undertaking and stuff that we're doing here for that. We did our last allotment that we received. We had 200 for essential workers and then 100 for comorbidities to get out into the community and stuff. So in the interest of getting it out to the community, we reallocated them to the Glens Falls Hospital, which are going to do one-day clinics at the Glens Falls family practices in Granville and in Cambridge, so that we can get them out to Washington County residents as soon as possible. It looks like we're gonna try to work with them so that we can continue doing our second doses as well as the first doses that we're getting and getting it out to the community. So hopefully they will not have to be traveling to other sites and everything else. For that. Just a little bit with the second doses, those of you that are going to receive your second doses, just make sure you're pushing fluids, you're taking your vitamins, boosting, whatever you do to boost your immune system and stuff, and take Tylenol. If you can take Tylenol, take that as regularly scheduled. This is just to decrease the amount of side effects and stuff. I am happy to report that everybody in our office, and we had everybody but one vaccinated, and also everybody has completed their second dose and with no work time loss. So they're real troopers and stuff at doing it. And everybody kind of followed the same protocol for that. So like I said, we are busy starting our second doses. We've got a busy week playing catch up, but we should be back on track by the end of next week because of the weather and then with the delay in the vaccine and stuff. So it's going to be next couple of weeks going to be pretty busy and stuff for us. Anybody have any questions regarding the vaccines?
I do, KJ. On the vaccine that you talked about going to Cambridge and Granville,
Yes.
that would be for the first doses, and am I correct on that?
Well, it will be the first and second doses.
Okay. And when does that open up?
We actually got the approval late last night that we can do the transfer, the reallocation. So Glens Falls is coming to pick that up today. And then they will be scheduling their clinic.
Excellent.
Yeah.
Thank you so much. Okay. Anyone else have any questions for KJ? Okay, go ahead.
Let's see. So we're continuing to work with our investigations and tracings and stuff. Our numbers are decreasing, which is a good sign. We are down to 85 positives currently. That is tremendous for us. So we are still using our virtual investigators as we need them, but contracting our use from them. We will be starting a school specialist this week. I believe she's starting tomorrow. That's going to help us integrate with the schools and everything. So they'll have more of a dedicated person like we were doing before. The nurses have been doing that, but the schools like to have one person that they can count on and stuff. And the school specialists have worked in other counties. And this is through PCG, so it's at no cost to us. So that's the public consulting group. So we are going to use the school specialist, and hopefully that will help us out with that. Especially with the school sports and everything else. We're hoping we don't see a resurgence in things, but if we do have another surge, then we should be in good shape to handle that. Any questions regarding that?
KJ, is that school specialist going to review each school's plan?
They will have access to each school's plan, and then they will be, like I said, interacting with the schools along with our nursing staff as well, if they need to be. But we have to get her up and running and stuff first and see how that goes. But she also has the benefit of having school specialists from other counties to help her out too. She will be only 25% in-house. That doesn't mean that she will necessarily be here. It means that she can come in here or she can go to the schools depending upon what's happening. Otherwise, it will be virtual, but she will be doing the investigations and tracings and coordinating that.
Wonderful. You've had a busy week.
Oh, we're busy all the time. And just one of my last ones is the rabies clinics.
Yeah.
With our grant year, which ends at the end of March, we still have to get in one more rabies clinic. That is a requirement. That's what's been the requirement in the past, is that we have at least 3 a year. Of course, with COVID, we have put them on hold and everything else. But we are scheduled to have one in March and stuff on the 27th, right near the end date. Colleen has done a great job of arranging that and putting this stuff out. So I believe all the supervisors did get that information and the DCOs, ACO out there so that we can have it. And we're hoping at least to get one in so that we will fulfill our requirements and stuff for our grant funding on there. And at present, our rabies is not being funded again presently in the budget. We're hoping that that will change. So we're trying our best to make sure we utilize what we can for that.
If that doesn't change, will that be on our dime?
Pardon?
If that doesn't change, will that be on our dime, or can we get out of that business?
Well, if we don't have funding for it, I'm not sure if they will change the requirements for it. But in the past, it has been on the county's dime that if we've utilized our grant money and stuff like that, then the county is responsible for the follow-up and stuff and post-exposure.
Okay.
Thank you. Any other questions for KJ? Yeah, Dave?
On the rabies, if people get rabies and they don't have insurance, does Washington County have to pick that up?
If they do not have insurance, Washington County does have to pick it up. If they have insurance but have a copay, then Washington County is responsible to do the copay.
So actually having rabies clinics, as I remember one case from, it was very expensive for the rabies treatment.
The rabies treatment itself is very expensive. That's why, they do bill the insurance first if they have that. But unfortunately, some people have opted to have large copays before so that they have smaller premiums. And if they have a large copays and stuff for it, then we are responsible for that until they meet their deductible for it to go to their insurance.
So in a way, it's safer to have protection than by having clinics.
It's good protection to have the clinics, yes.
Thank you.
Thank you. Anyone else have any questions for KJ? And KJ, do you have anything more for us?
I do. Well, the only other thing is just a little informational is that the flu numbers are still sporadic. It has not risen very high this year, so it is still sporadic. And they're, feeling that with the social distancing, masking, good hand washing, that has helped. So we've had a good flu year so far. And that's all that I have.
Thank you very, very much. Have a good week with the vaccination distribution and everything that's going on. Okay.
It'll be busy, but it'll be fun, especially because everybody's that wants those vaccines will be there.
That is for sure. And thank you for the good news that everybody in your department got their second vaccine and rallied through. I was thinking about the amount of people here that will get their second vaccines and thinking about Monday or Sunday.
Yeah.
And how it would work out.
Most just be prepared. Most of us, it was kind of the second day in the afternoon. You kind of felt a little bit of like you thought maybe you were getting a fever and a little tired and stuff, but then it was over. And like I said, by the second day third day, everybody was back to as normal as we can be.
That's encouraging. Thank you. It's good. Okay. So other business, I think we have Tammy here for some input, right?
Yes.
Good morning, Tammy.
Thank you. A few things have come up since the agenda was due, so I just thought it would be a good idea to give you just a quick summary. One of the things actually fell my way through the help of Laura Oswald earlier this week. There's an FCC broadband program in the works. I believe it was related to some sort of a federal act. And Hudson Valley Wireless specifically is working to create a program to deliver free broadband and device, like in the terms of a tablet to the low income population. So based on the rules for it, households might qualify for that benefit. And then somebody else, if only one person in the household qualifies for some of the income conditions that are usually associated with people that are lower income levels. So it does make sense to be working in collaboration with my office. I know that OFA is also very keenly interested in this as well. At this point, they're waiting for the federal or the final rules to be published, which should be within the next 30 days. And then enrollment can start 45 days after that. So we will have more information to come. I'm sure that our intent is going to be to saturate social media to let people know about this being available. It is also available through Verizon and some of the bigger carriers, but apparently so far they are just waiting to be contacted. They haven't actually taken the initiative to reach out and try to promote this or recruit people that might be eligible in advance. And then I also had received information that from the Office of Temporary Disability Assistance that our Code Blue plan, our budget that we had put in for request on that, which funds the costs of sending people to the open door mission as well as motels when that is necessary. This is during the time frame that it's 32 degrees or colder, and it's for people that don't qualify for our regular temporary housing. So that budget was $62,340. We'll claim up to that. We don't necessarily realize that full cost, but that's what we budget for. And it was a few months in the making before we finally got that approval, but it's good news. At the same time, we received notification that an additional $260,827 has been recommended to be forwarded to Washington County for use through the Emergency Solutions Grant Program, through the Coronavirus Aid, Relief, and Economic Security. So the CARES Act, this was something that we started working on in the fall. We received over $259,000 at that time. I have given you some updates on that. It took a while for us to get through to approval of our plan and then pull the money down and start taking applicants for that. But it is something that we had been told to anticipate that there would be a second allocation. There continues to be questions about how we can actually spend this out in the way that it needs to be when we are also at this point the moratorium on evictions. So we're trying to balance everything. We want to be able to get that money out and secure housing for people. We just have to make sure that we do so in such a way that HUD will continue to reimburse us.
That's wonderful.
So,
Tammy, what are some of the criteria it can be used? Can it be used for like cleaning supplies or those types of for local food pantries?
We submitted a plan, and so we put it in for prevention. Yes, there are things that we can do, cleaning products that we can provide. It really just, as long as it's something that ties into COVID. And so in this way with cleaning products, certainly does, as far as people keeping everything disinfected. The majority of what we think we'll be using it for will be people that have not been up to date with their rents, and people that are falling behind with any of their utility payments. That's where we think the lion's share of that money will go.
Yeah, wonderful. Thank you. Does anyone have any questions for Tammy on this? Okay.
Last, I just want to put in a little footnote. Twice a year, we try to, within DSS and OFA, we try to intentionally target some sort of an activity or a training to celebrate our staff. We do that, calling it employee appreciation, though of course we appreciate our employees every day of the year. But we do it once in April and then again in October. This past year has been challenging in our capacity to pull anything off like we had historically. But last year I had requested and was approved to spend up, I think it was up to $600 for purchases of supplies for us to do some sort of an activity with our staff for that spring employee appreciation timeframe, which of course we never followed through to do. So at this point, we're collecting some ideas from our managers of what they would like to do this April, what we can do with all of the social distancing requirements and et cetera. So if they come up with something that we do need to make a purchase for, I will consult the purchasing processes, and if it's absolutely necessary, I will be back to you in March for a request to purchase. But otherwise, hopefully it'll be something that's easier for us to work through. We've done anything from framing poems and us contributing, managers contributing money to be able to buy scratch off tickets, all the way up to having a trainer come in and doing a luncheon. So stand by, but I wanted to let you know that is something you've supported in the past, and I don't have a direct request right now, but I will come to you with one next month if I must do so.
Thank you very, very much. And we do value our employees. Yeah, Brian?
So I just wanted to ask Tammy, did the upgrade happen with your internet connection, and did you hear any more on the state paying that going forward?
The upgrade has not happened yet. We did ask for them to put that through. It is, it seems to be something that the state agencies right now are sort of locked into some sort of struggle with. The association that I talked to you about before, trying to advocate on this, has been blocked so far pretty effectively by the technical office for the state. And I have put out now 2 follow-up questions asking for a response and have not received anything. So going to need to go a little bit higher, I guess, over the heads of the folks that I've been reaching out to for our county specifically. But I also know that it's a statewide issue right now, and I think that there might be some sort of strategy on the part of the state around what they're willing to pay for.
That's so surprising. So I'll reach out to my people again too and see what I can find out.
It's the technology components that used to be individually allocated to different state agencies were then pulled all together into ITS, so another state agency. And it seems to me that that bifurcation has made it even more difficult. What I'm hearing and interpreting is that ITS itself is saying we're going to do the minimum, and then telling those other state agencies whose programs we administer for them, you guys figure out how to have that continue. So we're trying to see how we can encourage the state to work together and then provide for the counties the things that are necessary for us to follow through on those programs that they mandate that we must provide.
So ITS must be an acronym. It actually means it's not for us.
Sure. I think it's information and technology services, but
So, Tammy, anything else?
I don't have anything else.
Thank you very, very much. Is there any other discussion from, I see Rob York's on the line here, or anyone else that's for Human Services? Okay. With that being said,
Nothing from me, thank you.
thanks, Rob. Good to hear from you. I guess that's it for today. So we'll ask for an adjournment. Somebody make that motion? Okay, Brian, and thanks for everyone for coming. Have a good day. Go get your vaccines.
Thank you.
Bye-bye.